Obstetricians and gynecologists, often called obstetricians and gynecologists, these doctors focus on women's health, including pregnancy and childbirth. They do pap smear, pelvic exam, and pregnancy checkups. Obstetricians and gynecologists are trained in both areas, but some of them may focus on women's reproductive health and others specialize in caring for pregnant women. Oncologists: these internists are cancer specialists. They do chemotherapy treatments and often work with radiation oncologists and surgeons to care for someone with cancer. Type of oncologist: surgical oncologist, medical oncologist, radiation oncologist, gynecologic oncologist, pediatric oncologist, neurological oncologist. Ophthalmologist: what does an ophthalmologist do? When giving a comprehensive eye exam, an ophthalmologist will assess your vision and, if needed, find your eyeglass, contact lens prescription. They will test how your pupil respond to light, check the alignment of your eyes, and make sure the muscles that move your eyes are working properly. They will look for any early signs of eye problems such as cataract or glaucoma and examine the back of your eye and optic nerve. Ophthalmologists diagnose and treat your injuries, infections, diseases, and disorder of the eye. Treatments can include medication taken orally or topically, surgery, cryotherapy, and chemotherapy. Osteopath: a doctor of osteopathic medicine is a licensed physician who aims to improve people's overall health and wellness by treating the whole person, not just a condition or disease they may have. Osteopath can manage a range of conditions including neck and back pain, arthritis, headache, vertigo, pregnancy-related discomfort, tendonitis, spot injuries. Otolaryngologist: an otolaryngologist performs examinations, often using specialized equipment, to diagnose disorders and diseases of the head and neck. Depending on your symptoms, they may order additional testing, such as blood work, a sleep study, or a swallow study. They can also do comprehensive hearing, balance, or allergy testing at their work office. Pathologist: a pathologist is a medical doctor with specialized training to study medical conditions using human tissue, blood, pee, and other body fluids. They provide essential insight and information to help diagnose and treat conditions, monitor them, and provide prognosis. Through research, they can better diagnose disease of all types. Pathologists can work in several different environments, including community hospital and clinics, university hospitals and clinics, government hospital and clinics, independent laboratories, private offices. Pediatricians: they care for children from birth to young adulthood. Some pediatricians specialize in preteens and teen, child abuse, or children's development issues. Most pediatricians work in private offices, hospitals, and clinics. They may work alone or with other physicians and are usually aided by nurses, technicians, and clerks. Physiatrists: these specialists in physical medicine and rehabilitation treat neck or back pain and sports or spinal cord injuries, as well as other disabilities caused by accident or diseases. Physiatrists diagnose issues by performing thorough patient histories, physical exams, and, if needed, radiological imaging. For some situations, they may also perform electrodiagnostic testing to measure the condition of a person's nerves and muscles both in their relaxed and stimulated state. These tests may include nerve conduction studies or electromyography. Plastic surgeons: you might call them cosmetic surgeons. They rebuild or repair your skin, face, hand, breast, or body. that can happen after an injury or disease or for cosmetic reasons. Podiatrist. They care for problems in your ankles and feet. They can include injuries from accidents or sports or from ongoing health conditions like diabetes. Some podiatrists have advanced training in other subspecialties of the foot. Podiatrists are expert in foot, ankle, and lower limb health. They can help to prevent, diagnose, and treat a wide range of conditions, including ingrown toenails, heel and arch pain, skin problems, balance issues, sprains. Preventive medicine specialist. A preventive medicine physician is a doctor who specializes in the prevention of disease, disability, injury, or premature death. Preventive medicine physicians typically help patients before they get sick, whereas primary care doctors help patients after they get sick. Their goal is to increase health and decrease the risk of injury or spread of disease in individual and the general population. They promote health in order to prevent sickness or injury before it occurs. Do this preventive medicine physician may teach or counsel patient or group of people to educate them on health and preventive methods. Psychiatrist. Psychiatry focuses on mental health. Psychiatrists diagnose, treat, and help prevent emotional and behavioral disorders such as anxiety attacks, depression, and hallucinations. Psychiatrists employ a variety of treatment modalities, including psychotherapy, psychosocial interventions, and medication. Pulmonologist. A pulmonologist can diagnose and treat diseases of the respiratory system. They might have certain areas that they specialize in, like critical care, asthma, or sleep medicine. They might also specialize in treating children or the elderly. A pulmonologist works with patients facing serious or chronic breathing problems, while primary care doctors can handle mild or short term conditions, such as those caused by a cold and respiratory infection. You will need to see a pulmonologist to diagnose, treat, and manage more complex illnesses that primarily affect the lungs. Radiologist. Radiologists are medical doctors. All licensed radiologists have completed medical school and have a Doctor of Medicine or Doctor of Osteopathic Medicine degree. They use X-rays, ultrasound, and other imaging tests to diagnose diseases. They can also specialize in radiation oncology to treat conditions like cancer. Rheumatologist. They specialize in arthritis and other diseases in your joints, muscles, bones, and tendons. You might see them for your osteoporosis, back pain, gout, tendinitis from sports or repetitive injuries, and fibromyalgia. Rheumatologists work mainly in outpatient clinics. Primary care provider or other physician can refer you to a rheumatologist for evaluation. Many rheumatologists do not require a referral from another physician for appointments to be made. Some rheumatologists are affiliated with the hospital and will be asked to evaluate patients who are hospitalized for rheumatologic problems. Sports medicine specialist. A sports medicine physician is a highly trained healthcare provider who specializes in treating your musculoskeletal system. Your musculoskeletal system includes your bones, muscles, joints, tendons, ligaments, and connective tissues. Sports medicine physicians treat injuries caused by active lifestyles for both athletes and non athletes alike. General surgeons. A general surgeon is a physician who has been educated and trained in the diagnosis and preoperative, operative, and postoperative management of patient care. Surgery requires knowledge of anatomy, emergency and intensive care, immunology, metabolism, nutrition, pathology, physiology, shock and resuscitation, and wound healing. Urologist. These are surgeons who care for men and women for problems in the urinary tract, like a leaky bladder. They also treat male infertility and do prostate exam. What does a urologist do? A urologist can diagnose and treat many kinds of issues. Some urologists might practice without doing surgery, but all urologists are trained as surgeons. Sleep medicine specialist. They find and treat causes behind your poor sleep. They may have sleep lab or give you take home tests to chart your sleep wake patterns. What does a sleep medicine physician do? A sleep medicine physician is a doctor who focuses on training patients that have a sleep disorder. In this career, your duties are to help conduct an overnight study to monitor a patient's sleeping habits, such as the progression of their sleep cycle, how often they wake, and other data. You do this with the help of a sleep technologist operating polysomnography equipment. You use the data you learn from analyzing the patient's sleep patterns to form a diagnosis and treat the disorder with therapy or medications. Hospice and palliative medicine specialists. These specialists can be helped with relieving symptoms, coordinating care, making legal and ethical decisions, and handling issues around death and dying. They can be board certified in internal medicine, pediatrics, family medicine, and other specialties. What training do hospice and palliative medics in pediatrician have? 4 years of medical school, 3 years of residency training in pediatrics, board certification in pediatrics, additional subspecialty training in hospice and palliative medicine.